This takes us to our second speaker of the session. He is Dr. Mohammad Saad Khan, physical therapy physician in Jinnah Postgraduate Medical Center.
My topic is concerned. I think I am the only speaker who will talk about the non-pharmacological measures for treatment of pain. So, if we talk about non-pharmacological measures, there are several options, from behavioral therapies to psychotherapies to physical therapy to biofeedback. But being a physical therapist, I will talk specifically about physical therapy. So, in physical therapy, we use different types of physical agents for the treatment of pain. And as you can see here, physical agents are various forms and means of applying energy and materials to the patients, which include heat, cold, water, pressure, sound, and electrical currents. So, we can categorize physical agents into three categories. Number one is the thermal agents, which include heating and cooling modalities, then mechanical, which include traction, use of compression, water, sound, and third category is use of electromagnetic radiations, which includes electromagnetic fields and electrical currents. So, first is the thermal agents. Thermal agents transfer energy to the patients to produce an increase or decrease in temperature. We have different thermal agents present which produce greatest change in temperature in different types and tissue areas. For instance, hot pack produces a thermal change in superficial tissues, while ultrasound, which is a deep heating modality, it produces change in deep tissues such as tendon and bone. Then comes mechanical agents, which apply mechanical forces to increase or decrease pressure. First is the water. The clinical use of water is called hydrotherapy. So, water provides hydrostatic pressure to increase circumferential pressure. Second, it provides buoyancy to decrease pressure on weight-bearing joints, and this effect is very useful for prescribing the patients with joint pains. Then traction, which decreases the pressure between structures, and compression, which increases the pressure between structures. Then comes electromagnetic radiations. Electromagnetic agents apply electromagnetic energy in the form of ultraviolet rays, or in the form of electrical currents, or in the form of infrared rays. Variation of the frequency and intensity of electromagnetic radiation changes its effect and depth of penetration. Again, for example, infrared rays can work as a superficial heating modality, while if we talk about ultrasound, it is a deep penetration, or if we talk about ultraviolet rays, they have also a deep penetration rates. Now, effects of physical agents, these can be classified into these four general categories. Number one, they modify inflammation and healing. They can relieve pain. They can alter collagen extensibility, and they can modify, increase or decrease muscle tone. Topic is pain control. So, we will focus on the effects of these modalities on pain management. So, there are four different types of mechanisms through which these mechanical agents or these physical agents bring changes. Number one is the moderating the release of inflammatory mediators, such as a cryotherapy, which reduces the rate of metabolism and ultimately prevents the secretion of inflammatory mediators such as prostaglandins, histamine, substance P. Then modulating pain at the spinal cord level, this is the mechanism of action of TENS, then alternating nerve conduction and increasing endorphin levels. So, cryotherapy, thermotherapy, electrical stimulation and traction, which are different types of physical agents, are thought to alleviate pain, in part inhibiting pain transmission at spinal cord level. So, these physical agents act through these different four types of mechanisms can be used for the treatment of both acute as well as chronic pain. Electrical stimulation is also thought to control pain, in part by stimulating the release of opiopeptins at the spinal cord level, and physical agents are also effective and appropriate for pain caused by conditions that cannot be directly modified. For instance, you can use these physical agents for the treatment of pain caused by malignancy or rib fracture or any type of fracture. Second, they can be used for pain caused by peripheral nervous system pathology, For instance, you can use these physical agents for the treatment of phantom limb pain or peripheral neuropathy. Now, this slide is the most important from my lecture: advantages of using non-pharmacological agents for pain management. Number one, physical agents are associated with fewer and generally less severe side effects, which are usually seen with pharmacological agents such as GI disturbances and kidney damage. Second, the adverse effects are generally localized to the area of application, and these are easily avoided by applying careful procedure during treatment. Third, patients do not develop dependence on physical agents. Fourth, they do not generally cause a degree of sedation that would impair person's ability to work or drive. And last, few physical agents can be used independently by the patients to treat themselves, such as TENS. So, first agent is cryotherapy. Cryotherapy is the clinical application of ice or cold. Ice can be applied in a variety of ways, such as in the form of ice bags, ice baths, cold packs, or in the form of ethyl chloride spray. Cold treatment mechanism is, what is the mechanism? Cold treatment basically decreases skin and joint temperature, decreases blood flow, but it increases joint stiffness. So, in this picture you can see the methods of different types of cold application. On your top right there is a whirlpool bath with ice water. On the top left there is the ice bag, and bottom pictures shows on the left bottom there are the cold packs of different size and shapes are visible, and last one is the vapor coolant spray. So, it is very quite clear and evidence based several researches are available which proves that cold is analgesic. There is another effect of cold, which is that it slows the conduction velocity of peripheral nerves. So, this mechanism is actually helps us in the pain modulation at a spinal cord level. Then comes the ultrasound. Ultrasound as a therapeutic modality for pain relief is applied through the skin, and therapeutic ultrasound consists of inaudible acoustic vibrations delivered at a frequency between 0.75 to 3 megahertz. So, there is more evidence to support the use of ultrasound for pain relief over superficial heating modalities. So, it is a mechanical agent which is used for heating deeper tissues because it provides heat at tissue interfaces. These are the pictures of portable ultrasonic unit with the application. Ultrasound as a therapeutic modality for pain relief, superficial heating agents. We have several different types of superficial heating agents, which includes moist, hot packs, immersion in hot water baths, use of infrared light, and use of paraffin wax. Heat has an opposite effect to cold. What it does? Heat increases skin and joint temperature, and blood flow decreases joint stiffness. These are the various methods of applying heat. On the picture on the top right and left, you can see the application of infrared, and bottom left picture shows the hot packs or hydrocollator packs of different size and shapes, and bottom right picture shows the application of paraffin wax. Then comes transcutaneous electrical nerve stimulation, TENS. TENS is a very effective application for the treatment of acute pain. Although respected Dr. Mujahid is not very much convinced with the use of TENS and ultrasound, and he is right exactly that these modalities such as TENS and ultrasound are not very effective for the treatment of advanced stages of arthritis or chronic pain. So, we are talking about the acute pain management. So, TENS is used for pain relief in variety of patient populations, including post-operative pain, acute, as well as you can some cases of chronic pain, musculoskeletal pain, and especially neuropathic pain, as I mentioned that you can use it for pain associated with peripheral neuropathy. The most popular theory for mechanism of action of TENS is the gate control theory. You can briefly summarize it as if you block the if you stimulate the large diameter fibers, then this will inhibit the second order neurons in dorsal horn, and ultimately This will prevent firing of the small diameter fibers to sending the signals to the higher brain centers. So clinically, TENS is administered at varying frequency of stimulation, while intensity is determined by the response of the patient. So you can use TENS for both sensory stimulation as well as for motor stimulation. At a lower intensity, it will serve as a sensory modality, while at higher intensities, it will serve as a motor modality. So these are the pictures which shows the portable TENS unit with its application. Then comes interferential therapy, which is commonly used in UK. It is based on the principle that when two medium frequency currents are applied to the skin, a low frequency current will be induced in the deep tissue. So difference between the application of TENS and IFT is that the TENS is applied through superficial tissues, can be applied to the superficial tissues, while IFT is usually applied when you want pain relief at deeper level. These are the pictures of IFT unit. Then comes acupuncture. Acupuncture is administered by insertion of needles into designated acupuncture points, which is also called meridian points. In last few years, we have another method which is somewhat similar to this, which is called dry needling. So in dry needling, you basically adopting the same procedures, but here you insert needles at myofascial trigger points, and which can be identified after assessment. So number of clinical trials have proven the effectiveness of acupuncture, but if we talk about recent evidence, there is not a very good or strong evidence available for the efficacy of this type of treatment. Then shortwave diathermy. Shortwave diathermy falls in the domain of electromagnetic radiations, and the frequency spectrum for these electromagnetic rays is from 10 to 100 megahertz, and these are used again for pain relief at deeper level because it acts as a deep heating modality. Effects includes the pain control, bone healing, tissue healing. Then comes the traction. Traction is the application of mechanical force to separate or attempt to separate the joint. It can be applied it can be applied manually by the clinician or mechanically by using some machine. As we can these two pictures, the picture on your left shows the cervical traction, mechanical cervical traction, while picture on the right shows the lumbar traction. Traction is used for the cases such as disc bulge or herniation, joint paraspinal spasms, or facet pain. These are the conditions in which usually these tractions at lumbar or cervical regions can be applied. Then exercise. So far I have discussed the effects of physical modalities which are used by physical therapists. Then apart from these agents, physical therapists also use manual therapies, which includes exercises, manual therapies, as well as joint mobilizations. So exercise can have a relatively direct influence on pain perception, and these include exercises which have influence on pain. These include aerobic exercises, strengthening exercises, isometric exercises, mobility exercises. There has been an increased emphasis on moderate aerobic exercises as a means to improve function and self-efficacy in patients with arthritis. This is a recent evidence that aerobic exercises, active aerobic exercises, also reduces pain in patients with arthritis. Similarly, some studies have suggested that pain may be improved with aerobic exercise programs. This is another research. So there is a good evidence from basic science research to suggest that exercise is capable of activating endogenous pain control system. This is the mechanism how exercise relieves or alleviates pain. Now we have two other examples, research based. Number one, running 10 km has been shown to have an analgesic influence on thermal and ischemic pain. Second, this is the form of active exercise, running 10 km. Then similar increases in pressure pain thresholds have been demonstrated following moderately intense cycling for 30 minutes. Cycling is again in aerobic exercise, a form of active aerobic exercise. Then therapeutic massage. Massage includes range of procedures to move and mobilize soft tissues, particularly skin and underlying muscle tissue. Massage is considered to have a number of beneficial physiologic effects, which includes it induces relaxation, it improves mood state, and it also helps in pain modulation. So it is suggested that massage has beneficial effects on arterial and venous blood flow as well. Massage may be a promising intervention for the reduction of symptoms related to the delayed onset muscle soreness, and some techniques such as connective tissue massage may activate descending pain pathway. This is the mechanism of action, how it works. Then comes joint mobilizations. Mobilization techniques are procedures designed to increase the range of motion as well as to alleviate pain. So the movement may involve either an accessory glide of the joint or osteokinematics or physiologic movements. It is believed that these procedures may have beneficial effects on local tissues and they can suppress pain by activating neurophysiologic mechanism. In last, I want to show you some interesting slides related to the acute back pain treatment. As you can see the title, Evidence-Based Intervention for Acute Low Back Pain. I had adopted these slides from the National Health and Medical Research Council of Australia, and the council develops the evidence hierarchies or levels for prescribing different interventions or classifying different interventions according to the evidence weightage. So if we talk about acute back pain, we have 3 interventions which provide evidence of benefit. Number 1, advice to stay active. Number 2, heat wrap therapy, and number 3 is providing patient information in printed form. These 3 methods of intervention are most effective, or these have evidence of benefit in case of acute back pain. Then there is a conflicting evidence. You can see here muscle relaxants and the use of NSAIDs. These have a conflicting evidence for the treatment of acute back pain. Similarly, spinal manipulation also have conflicting evidence, which is shown by several systematic reviews in treatment of acute low back pain. Then there is insufficient evidence for use of mechanical agents such as acupuncture, bed rest, lumbar support, massage, traction, topical treatments. So all of these modalities have insufficient evidence to support the treatment in acute low back pain. So the take-home message or the bottom line from my lecture is that the physical agents have several benefits over pharmacological agents. Number 2, these agents serve as adjuncts for the treatment of musculoskeletal disorders, because we need to keep in mind one thing which is very much important, that we don't need to mask the pain. We need to identify the root cause. You can mask the pain by simply applying hot pack or ultrasound or TEN. But first, the thing which is important is to identify the root cause and then treat it accordingly. And third one, the use of physical agents, modalities in the absence of other skilled therapeutic interventions such as exercise or mobilizations should not be considered a physical therapy. Thank you very much. That's all from my side. Thank you very much.